Hello, I'm Dr. David Beisiegel, and welcome to our office. We're going to take a minute. We're going to talk about spinal care. This is a plastic model of a human spine, and this is the front, this is the back. The brain's up here. The spinal cord goes down through this hole. Your nerves exit between all your different vertebrae. That's how your brain communicates with your body, is through your nervous system. This model shows a little greater detail. Shows the discs. Remember that the discs are about 80% water and the rest of it is protein, pretty much. Where your bones come together, they're covered up by these joint capsules. These joint capsules secrete a fluid that keeps this nice and slick in here. When someone has an accident or an injury or an imbalance, what happens is the joints get irritated. It's kind of like having a pimple. You may not know that you have it. You put pressure on it, it hurts. You take the pressure off, it feels better. So very commonly people come in with injuries that are often hidden. And what I mean by that is they may have pain down where this nerve goes. Let's say if it was pain in your leg, often they have a problem in their lower back which is causing them pain in their leg. And unless you get a thorough evaluation, you may not know that you have a sore, swollen, irritated spot in your back that's contributing. The same thing happens when you're having headaches. Very commonly people come in and they're having headaches and have swollen, irritated joints or tissues in here which are affecting the nerves. So what happens is after an injury, when you have an accident or an injury, you have swelling. As that swelling goes down, you're left with scar tissue. Scar tissue is an irregular tissue and adheres not only to the joint capsule but to the tissues around it and can become a source of pain. Scar tissue is less flexible, and again it can adhere to the tissues around it, and because of the fact that it's less flexible, it distorts how the joints move. And so what happens is that since there's a lot of movement that occurs in the spine, the nerves can become vulnerable where they exit the spine. So what we're going to do is we're going to push this button here, and it shows that normally your brain communicates with your body, and then your body communicates back with your brain through your nerves. What happens is if you have a joint that's not functioning correctly, in chiropractic we call that a subluxation. And so what happens when you have a subluxation is it alters how your nerves normally communicate. So what happens is sometimes you have a nerve that's not communicating efficiently, so it results in more of a slow or an interrupted impulse. Other times you have a nerve that is hyperexcitable and is sending a lot more information, which often results in spasms or other kinds of difficulties. One of the things we do here in chiropractic, and is chiropractic's main specialty, is called an adjustment. And what happens when you adjust the spine, it normalizes how the joint moves. And when you normalize how the joint moves, it reduces the interference that occurs to how the nerve communicates. What happens where the nerves exit between the vertebrae is sometimes the nerves are getting pinched, but more commonly they're getting chemically interfered with by inflammation, or they're getting stretched, or they're getting some pressure on them from the inflammation, or they're getting twisted. And so it's very important to have normal mechanics in the spine if you want to feel and function correctly. The next thing we're going to do is we're going to talk about the spinal segments and how the discs degenerate. And so what happens is again, this is a textbook normal joint segment here. And so what happens is, again, like I said earlier, the discs are about 80% water and then they're protein. Now, one of the things that's very important for spinal function is how well the joints move. The discs, there's not actually an artery to the disc. The disc gets its nutrients from the bone above and below. And so if the joint's not moving correctly, that can affect circulation to the disc. And when you have poor circulation to your disc, then it rapidly degenerates. And this has been proven in many research studies. Actually, it was a study done with dogs, German shepherds, where they surgically interfered with how the joint moved and the joint rapidly degenerated. Another thing actually that causes an accelerated degenerative process is non-steroidal anti-inflammatories. So very commonly people think because a lot of the anti-inflammatories are over the counter, they're safe, and so often they take a lot of them. However, since they interfere with inflammation, they interfere with the first stage of healing, which then results in things not healing like they're supposed to, so it causes them to degenerate. So the next thing that happens is that as joints are not getting as good a circulation and not a good enough movement, then what happens is the disc height has a tendency to go smaller. And so what happens is that when you have a healthy joint, you have a lot of spacing between your vertebrae, and that spacing helps to keep less stress on the back of your joints. So as you degenerate and you lose that height, then what happens is you get more of a tendency toward inflammation and less space between your vertebrae, less space for the nerves. So then the next thing that occurs is that this is what's called, so we have textbook normal, phase 1, phase 2, and phase 3. So what happens here is this model shows some of the changes that occur to joints, and they occur for several different reasons. Bone, there's something called Wolff's Law, and bone migrates to the area of stress. And so what happens is when bones are less dense, then what happens is because there's more stress on the end plate, then what happens is the bone migrates up, and that results in this lipping and spurring that we see. And so we see a lot of people that have degenerating discs, and often they've had x-rays and other kinds of diagnostic testing, and they say, oh, you're bone on bone, and there's no way you can get relief. Well, that's simply not true. We have a lot of people that come in here that have very severe degeneration that actually obtain a lot of relief from chiropractic and the other therapies that we do. And the amazing thing is that people will often have no pain, and then they'll have a small little incident that causes them a severe amount of pain, and then they'll go and have diagnostic procedures which show them that they're bone on bone, and a lot of times they lose hope. And so the key thing is when you have degenerating joints, there are things you can do which slow the progression. There are research again showing that you can heal discs and that you can heal osteoporosis, and the key thing is we want to minimize any stress on the joints and normalize their ability to move, and by doing that you're going to normalize the nerve's ability to communicate with the rest of your body like it's supposed to. And so again, this is phase textbook normal, phase 1, phase 2, phase 3. On the fronts, that's how it looked like. On the sides, again, you get lipping and spurring. On the very back here, what you can see is there's plenty of joint space here. Then it becomes more narrow. Then you have arthritic changes, and then you have more arthritic changes. So really, people often come into the chiropractor's office and they want to have their back popped, or they want to normalize how their joints move. They don't know a lot about chiropractic, and the key thing is chiropractic can help. I recommend everybody, I really figure that there's 3 main types of stress: physical, emotional, and chemical. So physically, we've got to move right. If you're not moving right, that's going to create stress, and then stress is going to cause changes, and those changes are not desirable. So also, you have to eat right. You know, what you put in and on your body is very important to its ability to function. And then the other paradigm is to think right. Your relationship with God, your relationship with your spouse, your siblings, the things that are intimate to you. So the key thing is, using the type care we do, we create a lot of hope, and we arm our patients with knowledge so that they can care for themselves, understand why they're doing the care that we're doing, and help people avoid needless drugs and surgery. Very commonly, people have joints that are popping and grinding and are not moving correctly. This model I really like because it shows that normally if you have a healthy spine and you touch your head forward or you bend, each of the joints take an equal part of that motion. So what happens if you have a joint that's not moving correctly is the areas above and below have to move more to compensate for the lack of flexibility. So very commonly people come into the office and they're having headaches. The nerves that exit in your upper neck go up into your head. So sometimes people are having headaches, other times they're having eye pain or ear pain or jaw pain. But what happens is if you have an imbalance in your lower body, that changes the way you fight gravity and causes you to store stress. So the point is that we don't just look at your symptoms. We want to find the cause and address the cause. When you treat the cause, you get long-term resolution to the problem. When you treat the symptom, then what happens is you never get better and you're always chasing the symptom. So our goal is to help you to understand how your body functions, to help you understand what you can do to help it get better, and to understand that chiropractic nutrition is a vital role, plays a vital role to your long-term health. All right, so remember we talked about how the brain communicates with the body through the nerves. One of the things we do here to assess the nerves is we check different muscles. So we use muscle testing in several different ways. Again, so different nerves exit the spine and they control specific muscles, like the muscles that pull your fingers in and out. Those muscles are associated with your first thoracic nerve root. So by checking those muscles, we can assess that area. Other times what we do is we take a muscle that's strong and we have you do something that could be stressful for your body, like turning your head. So sometimes we have someone that's strong, we have them turn their head, it's no big deal, they stay strong. Other times they get very weak, and that gives us an indicator that that area is stressed. Another thing, let's say if we had weakness of your abilities to hold your fingers together, if we touch your head to the side and open up where that nerve comes off out of your spine, then that can affect the nerve in a way which results in its ability to communicate more correctly, and people will get strong. Remember, the muscles that are motor nerves communicate their signal at about 400 miles a second. So we're in Kansas City, so in 1 second, boom, Iowa and back. And so if the nerve has any pressure, is getting stretched or twisted, or has one of the other types of abnormalities, it can affect the strength of those muscles. And so we use that as a diagnostic test in order to give us information. The good thing is about it is we don't have to send you for an EMG, which we could. We don't have to send you for an MRI, which we could. But the key thing is we don't want to spend a bunch of time and money chasing down symptoms when we could really take that effort and put it into getting you well. So the key thing is we can do all the tests that we feel are necessary, but our goal is we want to normalize your ability to function. And since chiropractic care is safe, then we're very happy to do that. And a word on chiropractic and safety is I have $3 million worth of malpractice insurance. I know a lot of people say, wow, that's a lot. It is a lot. But the key thing is that my malpractice insurance to treat as many people as I can for a whole year cost me less than $1,500 a year. So my point is, chiropractic care is very safe. In fact, the vice president of the Stroke Association, when speaking, said, oh no, chiropractic is actually safer than aspirin. And in fact, it is. I actually had a patient within the last 3 weeks that almost died from an ulcer and almost bled to death from taking aspirin. And so very commonly, again, people are taking medications unnecessarily, treating the symptoms instead of treating the cause, And not only are they not getting the benefit they think they're getting, they're delaying the proper care and creating an unsafe environment within themselves. Thank you so much, and I appreciate your attention, and make today as great as possible.